Welcome to MB Updates, your number one stop to top entertainment and trendy political and local news.
First, where we are today is not the achievement of a single person. Very many people have made sacrifices, huge contributions. They have gone out of their way to get us to where we are today. And in a very particular way, let me say that the people of Kenya spoke loudly, unequivocally about their desire for a system or a medical system that leaves nobody behind, where families do not lose their property or their savings because of illness. And I want to say I'm a very proud Kenyan today that working with many people, and they have, many of them have stood here, Turanira there, Mwai, Blair, those people, they have worked with me for the last 2 years. We put this thing together for the campaign. We didn't know that we were going to have it for the laws of Kenya. And they have patiently worked with me, as Susan confessed, in many boardrooms in this building. Before the elections, they worked with me in another place. And then after the elections, they worked with me here. The members of medical fraternity working at the Ministry of Health. Kwanza tuwapigie hawa watu makofi jameni. I even tried to appoint some of them into some positions. They told me, no, we must deliver this thing first. And that's the kind of commitment that my team of advisors have. Let me also congratulate the leadership of Parliament. I mean, in record time, Parliament discharged its responsibility. And two things happened. We chose first that as we developed the laws at the final stages, we invited the two committees, at least the leadership, to participate with us so that they could bring their insights, they could bring their advice on board, so that by the time we finished the pieces of legislation, Parliament understood where we were going. That was step one. Step two, I also want to congratulate the creativity of Parliament. That on the bills that started at the Senate, members of the National Assembly who still thought they needed to be fine-tuned, gave the amendments they wanted to their colleagues in the Senate. And those in the Senate gave their colleagues in the National Assembly whatever amendments they thought would improve the quality of these pieces of legislation. Again, that demonstrated patriotism, creativity, innovation in how we discharge our responsibilities as Kenyans, but much more specifically, the creativity of our Parliament. Congratulations, members of Parliament. Wacha niwaulize wabunge wetu wakiongozwa na leader of majority wa Senate na National Assembly, tafadhali msimame tuwapigie makofi jameni. Thank you very much. Through you to your colleagues in Parliament, the people of Kenya appreciate the kind of sacrifice and commitment and input you have made. I cannot forget the two speakers for their wisdom. Both these two gentlemen are great leaders. Thank you very much. I know we spoke often on what needed to happen, and they provided guidance together with the clerks of our National Assembly, Njoroge and Nyegenye. I want to say thank you very much, gentlemen. Your contribution is immense, and we don't take it for granted. To our Council of Governors, we want to say we are truly grateful for your partnership. I did commit to our county governments that this administration will not undermine our county governments, and that this administration supports fully county governments in the discharge of their responsibility on health and their mandate on health, and that we are going to work together to make sure that counties succeed, because when counties succeed, Kenya succeeds. And I want to say we congratulate you for your input, as always. And the encouragement that we've gone through this together. And I want to give you my assurance, Chair, my friend Onesmus Muthomi Njuki. I want to give you my assurance that we will not let counties down, especially on the subject of health, because by letting counties down, we will be letting Kenya down, and that we will not do. As you have said correctly, there will be a follow-through with regulations that will underpin some of the specific items of this piece of legislation. A lot of work has gone into the development of regulations. We will now take them through the processes, making sure that the public have a say, making sure that all the other stakeholders are brought on board, so that we can have the chance to implement universal health coverage this time round and succeed. It is the one thing that we must get right. Because Kenyans collectively aspired for quality, affordable, and accessible healthcare system. Not for a short time. We've been here for a very long time. Speaker Wetangula will remember in 2012 with President Kibaki, we tried, but we didn't quite get it where we wanted. We tried again in 2017, 2018, but the trials that went in Nyeri, Isiolo, Kisumu, and one more county, there were 4 counties, and Machakos. You remember they failed. The whole thing collapsed. And it was because it needed some thorough thinking. And that is why this time round, we decided to create a firmer base based on legislation. And therefore, since independence, significant efforts have been made but we have never quite gotten where we've always wanted. But that is changing today. We have reached a pivotal moment in our quest to reshape our healthcare delivery system. Today, 4 crucial bills for the implementation of universal healthcare have become law. These laws, together with various policies, strategies, and regulations that will be subsequently implemented, including the community health policy and primary health care and health financing strategies, will lay the firm foundation for the biggest change in our healthcare system ever witnessed. In the Kenya Kwanza Manifesto, we committed to achieving universal health coverage using various instruments. Number 1, we say there must be a fully financed primary healthcare mechanism comprising preventive, promotive, curative, palliative, and rehabilitative services. We also undertook that there will be integration of ICT into our healthcare ecosystem to enhance telemedicine, health management information systems, mobile health, and especially the portability of health records, as was explained here by Mudomi Njuki, when he said that health records are in all manner of shapes. They are in pieces of paper, exercise books, foolscaps, and all manner of paper. But now, with the laws that we have passed, you just need to identify yourself, and the doctor can pull out your health records, diagnose, know what kind of medicine you've had before, know what kind of condition you've suffered from before, and be able to assist you going forward. This opportunity also, we said, we must ring-fence healthcare funds using facility improvement legislation. And that is the legislation, the FIF legislation we've signed today into law, both for national government hospitals that are referral and even for all the other hospitals down to the village. This is to protect money that we collect from healthcare facilities not being used to construct pavements or gates or other pieces of infrastructure, but so that there is adequate resources to make sure that there is replenishment of health commodities, there is improvement of health facilities, and that we enhance the quality of delivery of our health systems. We also undertook that we would setting up an emergency medical treatment fund to cater for emergency cancer treatment, referrals, and other chronic ailments. We all know that many Kenyans become destitute because a member of their family had cancer or they got an accident or they were in an emergency. We have seen situations where there is an accident or there is an emergency, somebody goes to hospital, and they are turned away from hospital because they don't have a health card, they don't have someone to sign for them. This will be a thing of the past when we pass these laws. Providing National Hospital Insurance Fund coverage for all Kenyans was one of our undertaking. And we said this time round, it must not have exclusions. And it must cover everybody. Nobody should be left behind. Many Kenyans have asked me often, okay, we want to reduce from 500 to 300. Many Kenyans have asked me, what happens to the person who cannot afford 300? I want to say, under the laws we have passed, even those who cannot afford 300 will now have an opportunity to have an insurance cover, so that we can truly say no Kenyan will be left behind. And of course, to strengthen our human capital resources so that we can deliver on this whole universal health coverage endeavor. The enactment of these laws, the Primary Health Care Act 2023, the Digital Health Act 2023, the Facility Improvement Financing Act 2023, and the new Social Health Insurance Act 2023 provide a legal and institutional framework for a new dawn in our healthcare system. With health insurance coverage at a low of only 26% nationally, out-of-pocket costs are decimating families and keeping sick people away from treatment. The new Social Health Insurance Act will now address financial barriers to healthcare and the existing challenges faced by NHIF by establishing the Social Health Authority. This law will repeal the current National Hospital Insurance Fund Act and establish 3 new funds as follows: the Primary Health Care Fund, the Social Health Care Fund, the Emergency, Chronic, and Critical Illness Fund. These funds will ensure public-funded primary health care, emergency care, and universal health insurance, while also promoting equitable access to quality health services. The Primary Health Care Fund will finance services from health facilities at level 1 to level 3, while the Social Health Insurance Fund will cover services at levels 4 to 6. The Emergency, Chronic, and Critical Illness Fund will fund emergency and chronic illness costs once social health insurance is depleted. This fulfills the express wishes of Article 43(2) of the Constitution, which provides that no Kenyan should be denied emergency medical services. As you're all aware, this has not been the case so far. The Primary Health Care Act addresses the current health imbalance in Kenya by emphasizing preventive and promotive health services. The Act introduces a framework for the effective delivery of primary health services through networks that include all healthcare providers, whether they are public, whether they are private, or even faith-based. Kenyans have voiced their desire for change in healthcare, highlighting high costs and limited access to curative services. In response, we are committed to a community health approach that emphasizes prevention and promotion. Less than a month ago, we flagged off the kits that over 100,000 community health promoters will use in our counties. Tomorrow, during the Mashujaa Day celebration, we shall unveil these promoters and deploy them countrywide. Each community health promoter will be responsible for 100 households, and they will have kits and phones to enable them work effectively, efficiently, and in an accountable manner. The national and county governments will share the responsibility of stipends for the promoters, and our goal is to bring healthcare directly to Kenyans' doorsteps, significantly improving accessibility and affordability. The Facility Improvement Fund Act will counter the decrease in funding for public health facilities, which often lack the requisite levels of investment, leading to a lack of autonomy, fragmented services, and poor outcomes. This law will entrench financial and managerial autonomy to enhance decision-making, efficiency, and community involvement in the management of facilities. While some counties have attempted to ring-fence health funds, only 26 out of 47 have succeeded. The Act provides guidelines to ensure a unified approach to facility autonomy, enabling them to independently retain and manage funds, ultimately improving resource availability, quality of services, and also enhance efficiency in the delivery of health. The Digital Health Act will streamline the adoption of technology in the health sector, enabling improved data sharing and resource utilization. This law will address the existing legal and regulatory gaps in the framework for e-health ecosystem and its data lifecycle, enabling the development of standards for the provision of mobile health, telemedicine, and e-learning in matters around healthcare. It has the potential to personalize patient care, improve quality, and empower communities. Our national healthcare journey has been long and at times painful. Indeed, most Kenyans have always insisted healthcare is the public service that they want the most. It is their number one priority. Today, we have made a significant step towards making healthcare universal for all Kenyans. I thank and commend the people of Kenya for actively shaping these laws through various public engagement platforms. I also thank, as I have said, the Council of Governors, county governments, development partners, and there are many. I know this event was convened at short notice. There are many development partners who have come through and supported us in this endeavor. And of course, the National Assembly, the Senate, our collective body of Parliament for doing a fine job. These laws will transform healthcare in Kenya. They will save lives, empower communities, and make us a stronger and a healthier nation. Congratulations to everybody. We will be seeing off the community health promoters tomorrow. I wish you well. Asanteni sana. God bless you. Na tuonane kesho. Thank you.